here's the thing I always find interesting about headaches, is that a lot of people define them based on their symptoms. But 99% of them all come from the exact same place. And so it's interesting because you'll have migraines, tension, these are the big ones, and then you can have hangover headaches. That's chemical induced. And there's like 2 or 3 other ones, but
hormones too.
That's a chemical as well. Really? And then the other one, there's like transient ones, and there's a few more. But the truth is, they're all neurological based. Even the ones that are hormone based are neurological based, because the hormones are variated by the neurology. So how the nerves determine the production of how the body works. Now, the majority of them, people are like, well, I have a headache here and it's right behind my eye, or I have a headache here and it's behind my head, or it wraps around and it goes like this. And when they're telling me this, what they're really telling me is that they have a headache that has started because of a stress induction. Because when we're stressed and we're in sympathetic tone, so when I say sympathetic, that means defense mode. We're in fight or flight. And parasympathetic is relaxation. When we're in stress, there's a cranial nerve, the spinal accessory nerve, or not spinal accessory, cranial nerve 11, yeah, spinal accessory. And its job is to pull your shoulders up. This is the only cranial nerve that turns on a muscle. So when I say cranial nerve, this is a nerve that comes right off of the brain stem. All other nerves that turn on muscles have to go through the spinal cord and then come out and be turned on or off.
So where is it?
Right on the brain stem. So the same nerves that go to your smell, hearing, all that, they come off the brainstem, and this one muscle is activated by this nerve that comes right off of the brainstem, right up here, and it controls your shoulders. So I always ask, well, why would we need that? And it's to defend your head from getting knocked off. So it's a very quick mechanism to defend yourself. Now what we see, though, is what are those 3 things that cause subluxations?
Thoughts and toxins.
And toxins, right? So we got thoughts, traumas, and toxins. If I spell stuff wrong, it's because I suck at spelling, so that's not done on purpose. So thoughts are usually the biggest indicator of headaches. Now here's the easiest thing that I've done for people. If you have a thought, and it's causing a headache, because most of them do, I don't want a headache, I don't want a headache, I don't want a headache, and then they get a headache. Or, I don't want to be stressed, I don't want to be stressed, and they get stressed. That's because you're literally fixating on what the problem is, but trying to not deal with it. Realistically, the easiest way to get rid of a headache is to accept it for where it is, and say, okay, I'm okay with feeling this right now. And the funny thing is, instantly it'll go away. Because you're prevented in pushing it away will make the headache stay. I've seen this with lots of people. So if it's a thought-based headache, it's literally because you're pushing it away and your brain's saying, I want you to look at this, I want you to look at this, I want you to look at this. Deal with it right now. And if you don't deal with it, it'll turn into a headache. And we've seen this, there's a lot of psychologists that deal with this. People have low back pain, and they don't deal with the low back pain. The low back pain is indicating some sort of emotional trauma or something gone in their life. So they go over and feel, okay, I have this pain, it's okay for me to feel it right now. It doesn't mean I'm going to die, it doesn't mean anything. I acknowledge it for what it is, and then the pain goes away. Because it's your body actually pulling to you and telling you, look at something. So a lot of headaches will actually be an emotional trigger of something going on in your life. And then by coming to me, I'm some sort of intervention to them, and then they can believe that it's gone and will accept that it will go away. But if you have a chronic headache that keeps coming back over and over and over and over, a lot of the times it's a suppressed emotion that you haven't dealt with. And so when you deal with it and accept it, doesn't mean you have to like it. I accept this is how I feel, I accept this is what it is, and now we can go forward. But if we don't accept what it is, then we'll keep pushing it off and it will become a traumatic thing that will keep running our lives. So that's one easy way to get rid of headaches. The other one, 95% of the time, if it's not neurological based, is dehydration. Literally dehydration. It is that simple. Now I can explain to you and show you why, but it's literally that simple. If you have a headache, and I tell my people, oh, you have a headache, drink 3 glasses of water, and in half an hour, if you still have a headache, then maybe we need to actually do something about it. But 95% of the time, it'll be gone. You just got to drink that water. So what happens is, when you drink in water, it's used to basically hydrate different parts of your body. Now, what we're going to do is we're going to draw the skull, and inside of it we got the brain. I know it looks like a balloon, but let's say it's not. And then what there is there's connective tissue that comes off the brains and the skull, and it holds the brain where it's supposed to be. And this is called the durarachnoid pia mater. It's the connective tissue that it holds the skull in place in conjunction to the brain, so it actually holds it in position. Now, what this does, this is really tight matter, it holds it so it doesn't move. But when you become dehydrated, less fluid is in the cerebral spinal space, and that's what this is right here. And when there's less fluid in here, the brain actually gets pulled on and will give you a headache. The majority of people who have hangovers, it's because of dehydration. And so if you hydrate them, they will not get a hangover. The reason they get a hangover is it's literally pulling on the brain. And when it pulls on the brain, then the brain has to make a decision of what it's got to do and how it's going to get you back to normal. So that will cause a headache. That's the same thing with the dehydration. Now, if you live in a hot, dry climate like Colorado, you don't even know you're sweating. And we're sweating all day. Because you sweat so quickly that the perspiration goes away. If you don't believe me, literally, take your finger, lick the top of your head, and then taste it, and it will taste very salty. That's because you've been sweating all day, but you just don't even know. And you'll see this in people that are golfers or tennis players or different things. They have these white lines all over their shirts. And it's literally all the sweat they've been pushing out and the salt that's left over. So we literally sweat all day. If it's a dry climate, we're sweating all the time when we're dehydrated. And that dehydration is huge. So dehydration and emotions are the two big ones that drive headaches. Now, if you want to go into the neurological stuff, we can do that as well. But these are the big ones. These are the easy ones for you guys to deal with and take care of them yourselves. Just drink a bunch of water. You don't need an aspirin. You don't need an Advil. And I'll give you an example of this. The body's ability to adapt indicates how you can heal. So, based on how you look at the body, as it being a victim and it doesn't know what it needs to do, or it's something smart and knows what to do, will determine how you'll react. So, if you have two people, they walk out into the Pacific Ocean and they look at the ocean and they go, wow, it's so beautiful. One person's wearing boots and the other one isn't. And the one not wearing boots, the water in the ocean's really cold and they start getting a headache. Your perspective of how you're going to take care of your body is going to be in full awareness right there. If one person says, oh, it's okay, I'll take an aspirin, that means they're based on symptom treating. And that means that if it gets bad enough, they'll cut things out and drug it to death. So they'll go, take an aspirin to make your headache go away. That's going to be a medical doctor. Now, if you talk to a physiologist or a chiropractor, a neurological-based person, they'll go, why don't you step out of the water so your blood temperature can warm up and then your headache will go away? Why don't you get rid of the cause of the issue? And that's the two ways of looking at it. So the cause of a lot of people's headaches are suppressed emotions. And because of the suppressed emotion, then they'll use substances. And that's how they become addicted to different things. Or it may be dehydration. And with a lot of people, it is that dehydration. So a lot of people, I tell them, drink, 2 to 3 glasses of water. The best thing I like people to drink if they have headaches is actually coconut water. Because it has a lot of natural, I won't say antioxidants, but it isn't. A lot of natural electrolytes in it, as well as some sugar, natural sugars, and a very easy way to hydrate you because it has a good pH for your body to absorb. So coconut water is very, very good. Those are the two easiest ways to get rid of headaches. Now, the other ones, when you look right in here, most people where their headaches start, they start in the back of their head, right here. There's no correlation or there's no randomness to this. Because remember those muscles I was talking about that pull up? When they get tight, they've shown that the muscle actually connects to connective tissue that goes in and connects to, guess what? The connective tissue around your brain. So what's been shown is that around the muscle is a sheath, and that is a connective tissue sheath, and that sheath is used to actually go through, and it goes through the skull, through the sutures, and actually goes right into the meningeal lining. And that's that arachnoid dura and pia mater. And so that connective tissue, when you're pulling on it, because you have a tight muscle, will pull on it and will actually start pulling on here. And then based on how your body adapts, torques, determines if you'll get a headache in your eye, on the side of your head, on the top of your head, because it determines how this connective tissue is pulled on, depending on what side it's pulled or wrapped on. That's where we see most headaches. Another easy thing you can do is push right up under the base of your skull. You push on there, it'll help you get rid of headaches. I'm telling you these things because I really don't like dealing with headaches. They're boring. And I know that's bad to say, but I'd rather take care of something really big that will drastically change people's lives. Because if you take care of the body correctly, which is adjusting the occiput, which is the skull, the C1 and C2 region, headaches are real easy to get rid of. They're real easy to get rid of. It's just how long has the body been trained that if I have this stress, I adapt in a certain way and then that gives me a headache. Because when you really start thinking about it, when you get a headache, start seeing if it's somebody said something to you, or you're driving to work, or maybe we had, besides an emotional, maybe we had a chemical trauma. Are we hungover? Did we take a medication? Most people are unaware that the medications they're taking for headaches will cause headaches. And you can get a thing called a rebound headache. If you take aspirin or Advil long enough, your body gets so addicted to it, if you stop taking it, it will give you a headache.
It's like caffeine withdrawal.
Exactly. It's the same thing as like caffeine withdrawals. So all of these things cause headaches. So why don't we find out the source and not just treat the symptom? So if the source is that you're angry because your wife or your husband said something to you, you're going to have that headache for the rest of your life until you deal with your communication problem. If your source is that you work at the airport and you have fumes that you're breathing in all day, you're going to keep having that headache. I had a lady who had sinus issues, and it was because she literally unpacked bags at the airport and she had jet fumes blowing in her face all day. As soon as we start figuring out what the issue was and she changed the way she was at work, all of a sudden her headaches and her sinus problems went away. So we're going to look at the source more than just a symptom. So when we look at this, so what we're going to look at now is the brain from the side. So we're looking at the same area. Now what happens is those muscles, they attach in here, and when they pull, they'll literally pull down on the head. And depending on how the connective tissue in the brain works, so the stuff out here is called fascia, and the connective tissue in the brains are called tentorums. They're just fascia in the brain. And what happens is, depending on how your brain is torqued, determines where you'll get the symptomatology in your body. Now, that's the majority of headaches. It's actually because of tension right up here in your neck. And that's why chiropractic is so good, because when we adjust you, we make the nerves turn on, the muscles relax, and then the pressure or the connective tissue stops pulling on, and the headache goes away. But we got to look at that cause, that causal relationship. What is the cause of the headaches? And a lot of people say, well, I don't know. All I know is that I smell something, or I just start getting them, or I get lights, or different things happen. Okay, what happened that day? Well, I just woke up with them. I don't like hearing that, because then we got a whole another gamut of things we got to go down. But 99.999999% of all headaches, neurological, aka we're out of alignment, pulling on our brain, dehydration, and emotional. The last 0.000000001% is some sort of pathology, like bacteria, tumors, different things like that.
I get them from allergic reaction to like glue and
exactly.
And
so
building
toxins. So we got toxins coming in. But what happens is, we'll see certain people when they get exposed to a toxin, they'll become sympathetic dominant, and then they'll one time will get tired. It pulls on it, which pulls on your head, and then you get a headache. Now you can get them. Remember I said all of them are neurological based, or majority of them? The other ones a lot of people will get is hormone-induced headaches. So they get headaches based on when their menstrual cycle is coming in. Or some people will get headaches based on blood sugar levels. Some people will get headaches based on what they absorb in. And you can get headaches if the sugar levels are too low. So if you have a faulty bowel, because it's leaky, and you have enough toxins going through, it can cause vasodilation or constriction. Constriction will get small, and then you get a headache, because the brain's not getting enough nutrients, enough sugar, or you're getting too many toxins. Now, the reason why the bowel's sick is because there's no proper neurological flow. So that's a neurological cause for a bowel problem that caused a headache. Or say we have, you name it, the one like you're talking about, Ms. Donna, where we have people who get headaches when they're exposed to paint, or when they're exposed to a certain smell.
Well, you know, they
odor.
do the non, what is it? Not VSO, what do they call that stuff? They have the new paint that doesn't have that odor.
Yeah, 100%. And
just for that reason, I think.
the odor is, what it's doing is you have a specific reaction that you take. And that reaction is a defense posture. And by getting in that defense posture of having that cranial nerve turn on and the muscles pull up, the muscles that turn on from the cranial nerve are your shoulders. So your shoulders pull up. And then that's going to put tension on your neck. And if you're there long enough, it will cause a headache. The other ones, and these are the easier ones to deal with, are structural-based headaches. These are headaches because you literally drive your car like this all day. Now, does this sound the same as what I was seeing before? Where the tension's on the back of the neck, pulling on, we get a headache. A lot of people will get these headaches because they sit at work. And when they sit at work, they're like this. And they get low back pain, or not low back pain, usually mid back pain or low back pain, and then it turns into a headache. Because their head is so far forward, it's pulling on the brainstem again, and the body's getting shut down. It's always the same thing. It's just, we, in our educated intelligence, or our ability to diagnose something, think that if we diagnose it and tell you that it has something and then give you a drug, then you think you'll be better.
Well, they want to run MRIs and everything.
Yeah, well, of course, because when you look at a symptom treater, a symptom person, they'll give you a drug, and if the drug doesn't make it go away, they think it's something worse. And that's why we see crazy things in our office, like we see epileptic seizures and seizure people in here, because the body heals itself. Am I treating the seizures? No. Am I treating the subluxation that is ultimately causing the seizures? Yes. Because the body's inability to adapt is what's causing the seizures. Or the body's inability to adapt is what's causing an addiction. Or the body's inability to adapt is what's causing you to eat or crave. All these different things are adaptation questions. Why can't we adapt correctly? If we can't adapt correctly, then why do we have that problem? And that's what it really comes down to. Headaches are really quite simple when you figure out what the cause is. And the cause, the majority of the time, is an improper neurological flow. And you go, well, what if the headache is due to a bacterial infection or a tumor or all these? You go, okay, what allowed it to grow? Your inability to adapt. Because you couldn't adapt correctly, it ultimately goes back to that. But I have this now, okay. You have a rusted car because you didn't paint it. You know, if we paint it, we'll be okay. We got to do preventative measures. If we take care of you and make sure that you can adapt correctly, then you will adapt to every environment in the right factor. Yes, James?
As you say, the desire to drink alcohol is a lack of ability to adapt.
Yes, the desire, that's going to be an addiction, and that's going to be a dopamine problem. So the body can't adapt correctly, so it'll respond out, and it'll respond by doing a specific habitual thing to get the dopamine payoff. That's everything from gambling to sex to ADD, ADHD, movement type things. That's a dopamine dysfunction, where they have to move to get enough dopamine to feel well. The alcohol will increase the dopamine production and they feel better. And so that's that inability to adapt. All of these things are a lack of adaptation. It's really that simple. The adaptation where you can change correctly, and it's called allostasis. If you have an allostatic ability, which means your ability to adapt to any environment. Homeostasis is the ability to adapt to a single environment. But allostasis means I can adapt to 25 degrees and then go outside. Well, say it's 70 degrees in here, and then I went to school in Atlanta, and then you walk outside and it's 100 degrees and 100% humidity. Your ability for your body to quickly adapt allows you to be okay.
And that's called?
Allostatic change. But if you could not adapt correctly, you would have a lot of problems. If you could not increase your heart rate, cause vasodilation and vasoconstriction in specific organ regions, so energy went to specific places. If you could not cause your body to circulate heat quickly through your vessels, then you get a problem. You faint, because you can't adapt. Your inability to adapt is what caused your problem of fainting because you went outside and it was too hot. The heat wasn't the problem. Your ability to adapt is the problem. So the bigger thing that we want to look at here is what is our adaptability? And what runs the adaptability is the nerve system. Headaches are just an inability to adapt due to a stress, chemical, emotional, or physical. And that's why we're really good at taking care of people with headaches, because we teach their brain through an adjustment. We actually teach the brain to become more adaptable. Each adjustment actually changes the neural pathways. We actually cause more neural pathways. The neuroplasticity increases. And increasing them, you can adapt quicker. So if you adjust them and their neck stiffness is causing the headache, we get rid of the headache real quickly. If their emotional is causing it, get rid of it real quickly. But then you have to ask yourself, what's the ultimate cause? Why do they have it? I've seen people and they have headaches because they literally have learned to adapt like this. And so they're adapting like this, and they're walking around like this. You think this would cause any problems with their body? It causes a lot of problems. And an easy way for you to see how healthy or sick a person is to look at their posture. Their posture tells you how they adapt to the environment. The more erect somebody is, and the farther back their head is over the midline, the healthier that person is. And you can see this, and if you want to see it, you can do your own little study. Go to an old age home. The healthiest people are standing erect, and they take the least amount of drugs, because that means that their brain is balanced and they can adapt correctly. The more forward their head goes, the more stress there is on the brainstem. That causes headaches. It also causes compression of the brainstem itself, so the body starts shutting down, so they can't adapt correctly. And then they start getting heart, lung problems, bowel problems. And then you see the real sick people, they're in the wheelchairs. They're going around like this. And their inability to adapt is what's led to the deformation of the bones. You get Dowager humps, the big bumps on their backs, and it just goes downhill real quickly. Because the thing about the body is, it is a use it or lose it type thing. If you keep using the neurology, firing it, and when I mean using, I mean literally like walking. If you keep walking, then you don't know how to walk. If we put you in a bed for a couple months, your body's not going to be able to do very well with walking, because you'll start losing these things. They'll demyelinate. They'll stop communicating real quickly. So continually use of it, and you'll see it with people in specifically geriatrics. If they break their hip, it's usually the end of them, depending on where they are in their life, because that stops them from moving. Their brain stops getting stimulus, and it starts shutting down. So what's been shown is your ability to feel happiness and to feel adaptability is based on how well your spine can adapt. And your spine's adaptation to the environment is directly related to your neurology and how well your brain can adapt. So for you guys, the big thing we want to look at is, are we dehydrated? Are we emotionally stressed? And are we physically stressed? That's what's causing the headaches. Now, we can get them if they're from a car accident, you had a huge trauma. But that's not usually the cause. Usually the cause is you're sitting there looking at a book for 6, 8, 10 hours doing work. Gives you a headache. You're dehydrated. You do these simple things and we can get rid of them. If you do have the one where the water and the emotional stress doesn't go away, then it's a neurological thing, and that's something I can help you with easily. Because that's 99% of the time, something out here is off, your skull usually, compressing your brainstem, causing a muscle tension, and that muscle tension pulls on the brain itself, and that's why you get the headache. You remove that, and the body heals. It's really that simple. We just got to turn it on so it'll talk correctly. Any questions?
Yeah, so you commented that if somebody goes to bed, feels great, no problem, wakes up with a headache, do you tend to find that the last cause, neurologic, it's misalignment of that skull that happened in the sleep, is it? What I've talked about,
that
emotional
can be
trauma.
many things. Usually what it is the person is so emotionally stressed that they give themselves a headache because they have bruxism or they're grinding their teeth. Usually they're going like this, and that's what's giving them the headache. And it's that stress pulling on the connective tissue again. Or they've got a pillow or issue. That's very rare though, that they wake up with headaches. It's still usually dehydration or stress again, because they're grinding their teeth. The reason the body does that is it causes them to relax more. Because when you eat, it turns on your relaxation center, so by moving your teeth, it turns on. That's why during the war, like World War I or World War II specifically, they gave a lot of the military gum, because it causes them to calm down.
Interesting.
So it can be that. The simplest thing is it's usually that stress. I have not found a headache that is not stress related yet. And if it's not that, it's interesting, it's usually glucose or water levels. It's usually they haven't eaten in a while and they have a headache. And then they freak out and they think if they give themselves Tylenol, it'll make it go away. And you want to look at the simple things. Do we have enough water? Are we emotionally stressed? Do we have enough sugar? Do we have enough electrolytes? It's really that simple, but it's hard to think clearly when you have that headache. You know, when you see people passed out on the street, it's sugar or water. That's usually what it is. It's not usually that they're so sick from something else that's the problem. So I don't have much to say about headaches because they're real easy to get rid of. That's truthfully what it is. A lot of doctors will say it's this, that, or the other thing, but it's that stress of the neck. If you have a headache, I guarantee 99% of the time your neck will be tight. You can touch it right here, and if it's tight, that's why you have the headache. Every single time. And that's why some people will go to massage therapists and they'll massage them, and the muscles will relax. But the underlying neurological stress won't go away, and that's why the headache comes back. And it goes away, comes back, goes away, comes back. So if you can get rid of that stress of your body being in a defense posture, the headaches go away. And sometimes they're so torqued and out of alignment, that's what's causing a lot of problems. I've even seen a fellow who was so bad when he came into my office. He's a neurologist, and he came into my office like this. He had torticollis so bad he couldn't actually lift his head up. He had really bad headaches and real severe, and most of his stuff was emotionally based. And so we helped him deal with that, and very quickly we adjusted him, and he righted himself up and was able to walk.
I saw it.
Mm-hmm. Yeah.
Amazing.
And that's what's possible when you let the body deal with it correctly. But if we give it a drug, the body can't deal with it, and then it keeps building up and getting bigger and bigger and bigger. A lot of people are not aware that they can actually get an autoimmune problem if they say hurt their ankle and they keep taking anti-inflammatories. They can get their body to a state where it won't turn off, and that'll turn into arthritis. And you'll see certain people get single joint arthritis because the body says, I'm going to turn inflammation on all the time because you won't let me heal it. So it's always adaptation. And the body does know what it's doing right as long as it can communicate. So the headaches first, dehydration. Second, emotional. Last one, neurological. Those are the causes. And then 0.00001% neurological, but led to tumor infection, something else. Those are so rare though. Like the stuff you see on house and stuff, it's so rare it's not even common. It's just very rare. Any other questions? Cool. So once again, like I said, if you know somebody who doesn't know these simple things, let them know they can come to this talk. And we don't charge anything, or watch it online. Because the big thing for me is to have you guys empowered to know that maybe I shouldn't take the aspirin, maybe I should drink 3 or 4 glasses of water. Maybe I should, I have a headache, maybe I should try some orange juice and see what will happen. Because it'll spike my blood sugar. Maybe I should see who's emotionally stressing me out first before I do something that could preferably hurt me or inadvertently hurt me. Because not a lot of people are aware of this, that aspirin every year will kill between 20 to 30,000 people because it causes ulcers and bleeding of the stomach. and we think it's okay because it's over the counter. It used to be you had to have a prescription, but it gets worse. So the reason why I'm saying this is because the knowledge, if it's good knowledge, is power. So I want you guys to be powerful and be able to be healthy, and say time out when somebody says, here's a pill. Because you go, what am I actually taking care of here? Am I taking care of my symptom, or what's actually causing my problem? Because if we keep drugging it, eventually your body will get to a point where it literally causes big issues. And that's called anxiety, depression, and emotional problems, because we've drugged it down so much that we just keep dealing with these things. So, it was a pleasure talking to you guys tonight, and we'll get you adjusted.